Hi everybody, welcome to week 4 of your practicum course. Nice to be able to talk to you again. I hope that you have been having a very nice Nurses Week. I have been really pleased this week with this year with Nurses Week. I've gotten some great things at my schools and it's been really fun. So I hope someone has acknowledged the hard work that you do this week. Okay, couple things. If I asked you to revise some of your overall practicum goals and you haven't had a chance to do that yet, please remember when you're done to upload them to your individual forum so I could take a look at those. A lot of you have already done that and I really appreciate it, and the revised goals look really good. So, okay, let's see. So the NEPD is due again this week. So basically, this is going to be turned in at the end of week 4. Okay, so it shouldn't be turned in until Tuesday or Wednesday. So this week you're going to be filling out the last column all the way to the far right under topic 2 that covers weeks 3 and 4. Then you're just going to fill out the first 3 columns of topic 3, which covers 5 and 6. So you're going to tell me if you met your goals for week 3 and 4, and then you're going to tell me what your goals are going to be for 5 and 6. It just kind of keeps you on track and keeps you planning, and also has you heading towards those overall practicum goals. Okay, so now that your overall practicum goals are finalized, I want you to insert them at the top of the NEPD form. There is a spot that says about your overall practicum goals. If you can just copy and paste and put those in there. That way, every time I open up your NEPD, you can and I can both look at those overall goals and see how you're doing every 2 weeks to kind of move towards accomplishing those goals. Okay? All right, good deal. So this week we're talking about self-reflection. So this is an activity that I really try to have undergraduate students utilize. I think it's very important, especially our students who are coming us right out of high school or very little real-world experience. They need to self-reflect and really think about some of the things that they're engaging in on their path to becoming nurses. So a few of the ones that I've tried that we've kind of mentioned in class, journaling. I think we've mentioned that a few times. I think it's wonderful when you have students do self-reflection journals after clinicals or service learning opportunities, different things like that. It's a great idea. One of the things that I used to do when I taught clinicals is in post-conference we would go around and every person would need to say one thing that they were proud of that day or that went really well that day in clinical, and then one thing, if they had it to do over again, that they would probably do a little bit differently. Could be anything, a skill, the way they interacted with an employee, the way they interacted with a patient, could be anything. And it really was quite good, and people kind of empathized with each other and celebrated each other's accomplishments, and it was a nice self-reflection activity. Another thing that I was involved in is when students had to do their skills pass-offs in clinical, have to pass on assessment and central line dressing change and NG tube placement, all that kind of stuff. One of the schools that I was involved in, the students would partner up and they would practice together and help each other out. And then on the skills pass-off day, the instructors would just be kind of walking around. The students would pair together. One student would perform the skill while the other student was video recording their skill. And then they flipped, and the other person did the skill while the other person recorded. And then afterwards, they would watch their own video. They would use the same scoring sheet that the instructors were going to use, and they would do a self-score. If they did not feel that they had a good enough score, they could do it one more time. And lab times were opened up at different times to accommodate this. They only had 2 shots at it though, and then they had to turn in their score sheet and the video to their instructor for lab, and then that person would score it. But it was really good because you would also get your partner's perception on how you did. You'd do your self-reflection, and you'd use the same tool that you were going to be scored with by your instructor. So it was a really kind of neat way. No, I cannot take credit for coming up with that, but it was a great thing to participate in. All right, a few other things that maybe are out there to think about. Some schools use a self-reflection process when an error has occurred. Go back and think about your thought process. What did you see? What did you assume? What pieces of data did you tie together to ultimately go about producing this error? And that can be an incredibly powerful learning experience. In fact, it's kind of interesting because there's some folks out there right now that just got a grant that are trying to put together a national database to record information about student errors and student near-miss errors in the clinical setting. Trying to standardize that, seeing what we can gain from that. What does that tell you about your safety culture? So that's an interesting thing coming up. I've also had students write their personal philosophy of nursing, and sometimes that really causes them to think about, why am I here? Why am I doing this? How do I really think about patient care? Trying to get students to identify and then question their assumptions. So you can do this by presenting a case study that might have some controversial things in it. You can do this in one class. I had, and this was a little while back, but we were talking about AIDS and different infectious diseases, and I presented 2 videos of different people talking about AIDS, someone who had had it forever and was living with it as a chronic disease, and someone who had just fairly recently been diagnosed and was quite a bit younger. And their feelings about how they were treated by the healthcare system, their own personal feelings about contracting AIDS, and it was just meant to have people identify some of their assumptions and maybe challenge some of their assumptions. So that can be done using a lot of different types of things. There's an activity called free associated brainstorming that I was reading about, and the way it can be used in nursing school is with like new nursing students, when they just find out where that first clinical is going to be at and the patient type of patients they're going to be with and that kind of stuff. You could give the students like maybe 5 to 10 post-it notes and ask them to write down feelings that they're having right now, having just found out about clinical and their first clinical and the patients that they're going to be caring for. And then you can put them up on a board or a wall and then kind of try to group them. Sometimes people are a lot more scared or anxious or have preconceived notions about clinical that maybe you can help dispel and maybe alleviate their anxiety a little bit. So those are just several different examples of self-reflection strategies that we can use with nursing students. And then there's all sorts of self-reflection that we can do in our own lives and in our own settings. And I am looking forward to talking with you about all these things this week in the main forum. So I hope the last part of your Nurses Week ends up well, and I'll see you in the main forum.